You're listening to Health Professional Radio. Today my guest is Michael Peachey, Chief Executive Officer with Wellness and Lifestyles Australia. Michael, welcome to Health Professional Radio.
Thank you very much, Wayne. Pleasure to be here.
Now, Michael, wellness and lifestyles sounds like something we all aspire to, but it doesn't tell us a lot about what your firm does. So can you give us some insight into what it is your firm does and what geographic footprint you service?
No problems at all. W&L Wellness and Lifestyles, we are primarily an aged care services company. So we deliver specialist aged care services to improve the quality of life for older Australians. So our allied health services in particular, these include physiotherapy, podiatry, occupational therapy, speech pathology, and dietetics. Also in the health space as well, we also assist aged care facilities to receive all of the government funding they're eligible for and do it in a way that's both risk-free and sustainable for the sector as well. In terms of our geographic footprint, we provide these services for both aged and community care nationally, so all over mainland Australia, metropolitan as well as rural, regional and remote.
Now, Michael, are you an institutional-based service or do you also service people at home?
We also service people at home. We predominantly service aged care facilities, hospitals and day therapy centres. However, we've found that a lot of elderly people in the community may have difficulty accessing health professionals out in the community, so we also do private home client visits as well, so visit people in their home who have difficulty accessing transport or just want the convenience of being treated at home as well.
Now, Michael, I missed the list of allied health services you were doing. Just run through those again.
So, yes, excellent. So we provide physiotherapy, podiatrists, occupational therapy, speech pathologists, and also dietitians.
That's quite a range in the allied health spectrum. There's not much kind of missing from that list.
No, and we've found that this has been the health professionals with the largest need, particularly in the residential aged care facilities. So quite often the residents in these facilities have clinical needs in these areas, and so that's where we've expanded our business to focus into those core areas.
Now, Michael, you say you offer this Australia-wide?
Yes, correct.
So you're represented in all the states then?
Except for Tasmania. We've got nothing against Tasmania, we just haven't been down there yet.
So there's so many things we could say about Tasmania, but they're bound to upset the Tasmanians, I'm afraid.
That's right. We do plan on servicing Tasmania at some point in the future, so I won't say anything negative about them.
Now, Michael, most of our audience listening to us today are also health professionals. They're normally in hospital settings and aged care settings, so the doctors and nurses predominantly. What's the message you'd like to give them?
That's a tough question. I don't think I have any particular message to give them in particular. One point that really resonates with us in our organisation and our staff is that we're very big on taking our time to understand and then meet the needs of all of our clients. So we're very big on understanding that our patients are the person that receive our services, but also we like to deliver services in a way that meets the needs of all the other clients. So if we're talking about hospitals or aged care facilities, our clients also include the organisations we work for, every staff member in those organisations we interact with, and last but not least, actually our therapists themselves. So we have a very big customer-focused approach and try to balance those needs all at the same time. That can obviously be a bit of a challenge.
I can imagine it is a challenge indeed. Now, Michael, in every industry there are misconceptions, and it's my favourite question. What are the misconceptions about your products and services that drive you nuts and keep you awake at night?
I think one that jumps to mind straight off is with physiotherapy. So quite often there's a perception that our physiotherapists go into aged care facilities and all they do is massage the residents. The focus of our service is to improve the pain management and mobility outcomes for these residents. So our therapists are routinely looking for a way that we can incorporate other interventions to optimise residents' mobility, their dexterity and rehabilitation. And using this approach, it allows our clients to access active ageing services they otherwise couldn't, to help keep them as functional as long as possible.
You're listening to Health Professional Radio with Wayne Buckler, and I've been in conversation with Michael Peachey, the Chief Executive Officer with Wellness and Lifestyles Australia. Michael, how can people get in touch with you?
They can contact us on 088 363 1344. Alternatively, our website is www.wellnesslifestyles.com.au.
Now, every time I give phone numbers on air, I always get Facebook messages saying, I didn't have my pencil, you didn't warn us, so fair warning people, pencil's ready. That number was 08 8363 1344. Did I get that one right, Michael?
Correct, this way.
So by all means, if you're looking to get in touch with Michael, give him a call, or you can go to the website at www.wellnesslifestyles.com.au. Now, speaking of websites, if you've only just tuned in and you've missed our interview and you've missed Michael telling us about the service of Wellness and Lifestyles Australia, you can find a transcript of this story on our website, also a SoundCloud archive, and we're on YouTube as well. So, www.hpr.fm, and you can read the transcript. My name's Wayne Buckler. You've been listening to Health Professional Radio. Michael, thank you for being with us this morning. It's been a pleasure to hear what you do.
My pleasure, Wayne. Thank you very much for having me.
This is Health Professional Radio.